Hello everyone and welcome to our short therapeutic videos. Only 1 minute helps you to learn more. Today we'll discuss a common symptoms which is not commonly discussed, how to choose cough medication. We have two types of antitussive for dry cough. Central, which is include codeine and dextromethorphan. Codeine is not available in some countries. Controlled substance, has narcotic side effect and liable for addiction. Dextromethorphan has few side effects, less liable for addiction, and has equal effectiveness. Peripheral antitussive include benzonatate, which is not available in some countries and associated with altered mental status, headache, and dizziness. Lozenges, which is widely used for the cough originated above larynx like pharyngitis. Depend on side effect and efficacy of drugs. We could choose dextromethorphan or lozenges, depend on severity of cough. Recommendations: antitussive are not routinely recommended for children below 6 years according to American Academy of Pediatrics. Avoid codeine for a patient with a history of substance use disorder. Antitussive drugs are for dry cough only and not indicated in productive cough. Lastly, always remember, an expensive antitussive is not more effective than a cheap antitussive.